Hi, everyone. It's almost noon. If you're just joining, I welcome you to do an audio check. You can, on the side, there's a dashboard that lists a whole bunch of different options. So if you click on there, there's a sound check where you can click on and just make sure that you're hearing everything properly. Yes, and so we're going to start in a couple seconds. The other thing that I wanted to bring to your attention, if you have any questions, anytime during the webinar, you're more than welcome to click and answer your questions in the questions section of the dashboard. So good afternoon. Welcome to the health and safety rights, your health and safety rights at work and COVID-19. My name is Deanna Kimball, and I'm the Regional Education Officer for the BC region. I'd first want to acknowledge the unceded territory of the Musqueam people, where I live and where I'm broadcasting from. So where I work and live, and I want to express gratitude for all the Coast Salish and Indigenous communities across BC for welcoming us and to express that gratitude as visitors where we live and where we work. So as I said, I'm the Regional Education Officer for the BC region, and I'm going to be moderating the webinar. After about a couple minutes, I'm going to turn it over to Sharon Barber, who's the regional rep responsible for health and safety. And she's going to go through a presentation, after which we'll have a questions and answer section. And you will be more than welcome to answer or ask as many questions as you like. One of the things that I will be doing to assist Sharon is I'll also be copying questions that you do submit in the questions section of your dashboard. And anything that we don't get to today, we're going to work hard to answer those questions and provide that afterwards. So for those of you who are joining just on the phone, however, you're only going to be able to be in a listen mode. You won't have that interaction, unfortunately. But for folks who are on their tablets or phones or computers, you'll be able to ask questions and also participate in some polls that we will be having throughout the webinar. So as I mentioned, the webinar will be around 45 minutes with a Q&A as well. Jamie Mills, our Regional Executive Vice President, wasn't able to be here today. So he sent some words that he'd like for me to read out to you folks on his behalf. So Jamie's message is that he said, I want to acknowledge that this has been a very difficult time for PSAC members, for workers, and for all of us and all of our families. I was hoping to be able to participate along with all of you, but unfortunately, the Alliance Executive Committee is meeting today at the same time via Skype. Thank you for taking the time to join us on this important webinar. And thank you for all of the work that you are doing, whether that's in the public or private sector. As this pandemic runs its course, it's become obvious that all PSAC members have played a very important role in holding the nation together and helping keep things going. Whether that's the work of folks at the ASDC or CRA to help Canadians financially, over 5 million applications for EI or the Canadian Emergency Relief Benefit were processed between March 15th and April 10th. Or whether that means that you work at the CFIA, for CBSA, Department of Fisheries and Oceans, Department of National Defence, or as a commissioner, you are all helping to keep our food, our borders, our environment, and our communities safe, or doing one of the thousands of other jobs that you do every day. Thank you for doing what you do. I hope you find this webinar useful and informative, and do not hesitate to contact us if you have any questions about your rights in the workplace. In solidarity, Jamie Mills. So those are lovely words, and of course, we appreciate that sentiment from Jamie. Of course, again, if you have any questions, feel free to enter them in the questions box. The webinar is being recorded, and we will be posting the recordings on the PSACBC.com page after this session. You'll also be getting afterwards an email within a couple of days with some follow-up information for you. So to begin, I just wanted to read out a quote that our beloved and humble Dr. Bonnie Henry has said over the last few weeks. Our provincial health officer has said, "This is not forever, but it is for now." So we have to remember that many of us have not lived through anything like this before. And that uncertainty means that we have very little control over the things that seem perfectly normal just a few short weeks ago. What we do know is that we're not alone and that we are all in this together. To see where we all are right now, I'm going to ask for you to open up your questions box, and I want you to take a second and type a word in that area describing how you're feeling right now. So I'll give you a couple of seconds to content, concerned, healthy, gratitude, grateful, unsure, uncertain, feeling blessed, frustrated, overwhelmed. But there's a lot of, feeling connected, content. So this reminds us that we are all at different places, and we're at different places all the time, and that we're constantly moving through this, and there's no right way or wrong way to do that. So I just want you to reflect on that we're all feeling a number of different things, and we'll have all those different feelings at different times throughout what's happening. So again, we all want to thank you for attending the session. And I'm going to turn it over to Sharon for her presentation. I might not pop back on the screen, so if I don't, you'll hear from me during this section on questions, but I wish you all a good day for now. So Sharon.
Hi, good afternoon, everyone. Deanna, can you hear me okay?
Yes, I can.
Great, thank you.
Okay, you're welcome.
It's very exciting to be here with you today. I personally am feeling very connected with you through this webinar software. This is only my second time doing this type of presentation. Deanna's been really helpful, and I appreciate the effort you've put into it, Deanna. So let's have a look at our objectives for the day, if I can. Sorry about that. Move some of my screens that you can't see. So we're going to talk briefly about some of the key players in workplace health and safety. We're going to review the core health and safety rights: your right to know, your right to participate, and the right to refuse unsafe work, and the right to experiencing no discrimination or retaliation for exercising those rights. I'm going to give you a very simple roadmap to address your health and safety concerns at work, and we'll answer some of your questions about how those structures apply in the context of the COVID-19 pandemic at work. This is a really general presentation. It applies to provincial and federally regulated workers in British Columbia. The goal is to give you a real basic awareness of health and safety rights that applies not only to you as members of the union, but also to your family and friends who are working in the province. This is an overview. It's a very short time that we have together. My goal was to keep it short so that we could facilitate as much participation as possible. We will be doing more of these presentations in the future, And, you know, if you want to comment on whether you felt it was too short or too long, we'll look forward to receiving your feedback, and certainly tailor future presentations to what your thoughts are and what your needs are. So, but let's first have a look at who's involved in health and safety at work. I just want you to take a minute to think about that. Who are the key individuals in the workplace who are involved in health and safety? If you have a pen and paper in front of you, you can write them down, and I will give you the list that I've prepared in just a few seconds. So I broke the general players down to 5. You might have found more than that. I often hear about people identifying contractors, clients, members of the public that they're dealing with, other organizations that they share the workplace with, other unions that are involved in health and safety that we work alongside. Those other parties really fall under the employer. So let's have a look at what the employer is responsible for, their general health and safety responsibilities. So again, this is applying to both federally and provincially regulated workers. Federally, the legislation that applies is the Canada Labour Code Part 2 and the attached regulations. And the Labor Code makes employers responsible to ensure that the health and safety at work of every person employed by the employer is protected. In British Columbia, the Workers' Compensation Act says that employers are responsible to ensure a safe workplace and to fix any unsafe conditions within a reasonable amount of time. So in that context, the other parties you might have identified or thought about are really the responsibility of the employer. So if you have a client accessing your workplace, if you have a contractor accessing your workplace, they their behaviors have to be monitored and controlled by your employer. Some of the other parties are health and safety committees, of course, you and your colleagues at work, your union, and there is a legislator or regulator who are responsible to enforce the laws, the Workers' Compensation Act and the Labor Code. When it comes to health and safety committees, I hope that you're familiar with the structure. The health and safety committees are a joint structure where they are co-chaired by both an employer and an employee representative in the workplace. They exist to identify and address health and safety issues and really address them in a manner that's unique to your workplace. You could have a regulator come and tell you how to do things, but it might not be suited specifically to where you work. So it's really up to health and safety committees to not only identify hazards, but determine how they're best addressed at work. So you have a member on the health and safety committee. As employees, you have an employee member. I'm going to ask you a question. Think about whether you know who they are, and I'm going to ask you a question about that in a minute. But next, I just want to move on to talk a little bit about you, your health and safety responsibilities, and those of your colleagues, which really are, number one, to follow safe work procedures, use the equipment that's provided with respect to your safety, and you have to report hazards. It's an obligation for you to report hazards to your employer and report injuries as well to your employer and potentially WCB if you're seeking compensation for an injury. The legislator or regulator are involved only if issues cannot be solved in the workplace. You would have brought your issue to the attention of your supervisor, your health and safety committee, and if those issues can't be solved there, then the legislator or regulator will be involved and come to assist the parties in determining what they need to do to correct unsafe situations or deal with things like work refusals. So let's move to poll number 1. Deanna is helping me with this. If you're ready, Deanna. I would like to know if you have the name and contact information of the individuals that represent you and your colleagues on the Health and Safety Committee in your workplace. So you should be able to choose now between yes, I know who they are, no, I don't know who they are, and potentially, I don't know what you're talking about, Sharon. So that's another option, I don't know. So I'm getting a good response here. About 80% of the individuals on the call today actually know who their health and safety representative is on the committee, which is great. Almost 20% don't know those. So that's 1 out of every 5 of you don't know who your representative is. If you need to find out who your representative is on your health and safety committee, you need to talk to your local union representative. If you don't know who your local union representative is, then what I would recommend is you contact the PSAC regional office. Our contact information will be at the end, available at the end of this presentation, and we're going to help you find out who those individuals are. So thanks for responding to that poll. I'm glad to see that a good portion of you know who that rep is, but it's a little concerning that 1 out of 5 of you don't know. And I want to make sure that that situation is corrected, because your health and safety committees are working on issues surrounding COVID-19 right now, and you could be asking them questions and assisting them in identifying the hazards that exist. So thanks for that. I want to move now into your key health and safety rights. So those are the right to know, the right to participate, the right to refuse unsafe work, and the right to know discrimination. Your right to know means that you should be informed by your employer of known or likely hazards in the workplace and be provided with information, instructions, education, and training, and the supervision necessary to protect your health and safety. You don't just, you need to know that you're safe. You don't just need someone to tell you you're safe. You need to know, and the information that is being provided really needs to come from a qualified person. So who's a qualified person? That's someone who, through knowledge, training, and experience, is licensed or otherwise qualified to provide advice on the matter in question. And one example that I can think of that's very current is the question of whether you need to be wearing masks at work. I've heard that from a lot of different members across the province. They need to know if they need masks or not. I'm not qualified to tell you that. Your manager is not qualified to tell you that. Your local representative is not qualified to tell you that. So if someone pats you on the hand and says you don't need a mask, that could well be true, but you need to find out where they got that information. And if they got it from the 6 o'clock news last night, that's not sufficient. They need to get that information from someone who is qualified and understands the risks and hazards specific of your workplace, who you're working with, and whether those masks are required. So that's going to look different for every workplace. If you're currently working from home, you probably don't need a mask. If you're working at Mission Penitentiary, where there's an outbreak of COVID-19, then absolutely you're going to need a mask. And there's different workplaces and different risks in between, and only a qualified person should be informing that decision of whether you need masks at work. So if someone is giving you health and safety information, find out where they're getting it. So let's move on to the second poll. I want to know if you think that you have the information and knowledge you need to be safe at work during the COVID-19 pandemic. And again, Deanna's going to help open the poll. You have the options of yes, no, or I don't know. You guys are really quick responding to these polls. That's great. I can see the results come in real time. So it looks like about half of you feel that you have the information you need, which is great. Unfortunately, that means that about half of you either don't think you have the information you need, or you're not sure. And I would say if you're not sure you have the information you need, then you probably don't have the information you need to be safe at work. And we need to go and get that. The person to talk to first would be your representative on the Health and Safety Committee. Make sure that your questions are answered and your concerns are responded to in a timely manner and in a way that you feel comfortable with. Again, the information you're receiving might be communicated to you from a manager or a local health and safety representative, but what you need to know is that they got that information from someone who is qualified to provide it and was familiar with your workplace. So you have the right to participate in health and safety. Health and safety at work is the health and safety regime across Canada is seen as an internal responsibility system. So as opposed to regulators coming down and looking at your workplace, they expect workers and employers to solve health and safety problems together. That means that your participation is very important in health and safety. One of the ways you participate is by reporting your health and safety concerns and making sure that you receive a response about your concerns. You can expect a response in a timely manner from your supervisor. You can participate in health and safety as a member of the Health and Safety Committee. Most workplaces require workplaces with over 20 individuals need to have a health and safety committee, whether that's a federally or a provincially regulated workplace. You can make suggestions to the Health and Safety Committee or to your supervisor on how to make your workplace safer. They will be looking for creative solutions, to any given hazard. So if you have ideas, share those with your health and safety representative or your supervisor and ask them for feedback. You can participate in health and safety through your union. The union has power and input through health and safety committees, consultations, and potentially filing complaints to Labour Canada, the Workers' Compensation Board, or through your collective agreement in the context of a grievance. Your right to refuse unsafe work. So you not only have the right, you have an obligation to refuse dangerous work. The legislation reads a little bit different, but essentially this right is triggered in a really similar way. In British Columbia, the legislation says that you must refuse work that would create an undue hazard to the health and safety of any person. In federal workplaces, the legislation says that you must refuse work that could be an imminent or serious threat to a person exposed to it before it's corrected or altered. If you don't know that the work is safe and you've made an effort to participate by expressing your concerns, you not only can, you must refuse the work until the situation is corrected, either corrected to your satisfaction or corrected to the satisfaction of a regulator. So there's clearly a process involved here, and I'm going to outline that for you. One thing I want to make sure you know, though, is you also have the right to be wrong. If you're not comfortable and you're not sure that you're safe, but you're not sure that there's an undue hazard or there's an imminent or serious threat, but you question it, you can still refuse. And if at the end of the process, Labour Canada or WCB comes in and says, you know what, this work wasn't an imminent hazard, it's not an undue hazard. If you took that action in good faith, there's no retaliation and you still would have done the right thing and solved your concerns or addressed your concerns in this manner. So the process to refuse, this is very simplified, again, to keep the presentation short. You report the situation to your supervisor and you tell them that you're refusing unsafe work. Typically, you would not be doing this from your sofa at home with your feet up watching television. You actually have to be at work to refuse unsafe work. You would move to a safe space and tell your supervisor right away. We don't want your boss calling you 2 days down the road saying, hey, where have you been? And you said, oh, I refused work last week and I'm watching soap operas. You need to report it, be clear with what you're doing, and you have to be in the workplace when you do that. The next step is that the supervisor is required to try and solve the problem for you. If the supervisor cannot solve the problem to your satisfaction, then the situation must be reported to your health and safety committee in the workplace. That's why it's so important that you know who they are. The health and safety committee is going to review the situation and develop some recommendations to repair the problem. If that does not satisfy you and you still are concerned about your safety, then Labour Canada or WCB, the regulator applicable to your workplace, must be contacted. The fourth step is Labour Canada or WCB will investigate the work refusal, and they'll determine the appropriate outcome. No one throughout this process can tell you to return to do the work until Labour Canada or WCB tell you that themselves. Generally, work refusals are solved at step 1 or step 2. They don't often get to step 4 because the situation is fixed, the person is satisfied, and they return to work. If it's not solved, they still can't force you to do the work until you're satisfied, or Labour Canada or WCB tell you that the work is safe. Your supervisor might find that Sharon, who sits next to you, is very happy to do the work. That's okay. If you're not comfortable, you can refuse. I'll get someone else to do the work. That's not a satisfactory solution. They have to continue through these steps, even if they have found someone else who's comfortable to do the work. These 4 steps have to be followed until you're satisfied, or until Labour Canada or WCB says that the work is in fact safe. There are some different processes for our members who work on board aircraft or work at sea on ships. You can still refuse work, but the process is different. And it's important to be familiar with that. So if you are working on an aircraft or on board ships, please let us know and we can walk you through the process there. There are also a few exceptions to work refusals. The only time you can't refuse unsafe work is when the hazard itself is a normal condition of your employment. So just as an example, if you are a window washer and you go up on high-rise buildings and you have the training and the equipment you need to get up onto a scaffold and go up 32 floors and wash the window, would not be possible for you to refuse work saying, well, I can't go up that high. It's a hazard to be on the 32nd floor outside the window, as long as you have the equipment that you need to do it. If you're a firearms instructor, you can't refuse work saying, I can't go to work because there's guns there. Guns are dangerous and there's an imminent hazard. If that hazard exists, generally it will have been worked around. So you would have the training and the information and the safety equipment you need to deal with those pieces safely. So if the hazard itself is a normal condition of employment, then a work refusal wouldn't be accepted. The other time that you can't refuse work is if the work refusal would put the life or health of another individual at risk. So that brings us back to the example of people on aircraft. You can't have a pilot refusing unsafe work when the aircraft is in the air because it would put anyone else who's on that plane's life at risk. So there's a different process for those individuals. Having said that, don't let your manager tell you that this hazard is a normal condition of your employment. If you don't feel it is, then you can pursue these steps, and Labour Canada or WCB could determine that themselves. So you have the right to no discrimination for working through these health and safety rights. The employer cannot retaliate or discriminate against you in any way. This is enshrined in the Labor Code and the Workers' Compensation Act. This law is taken very seriously because it is the foundation of health and safety, is your ability to participate and report health and safety issues to your employer. Again, this is taken very seriously by the regulators. So if you feel that you've been retaliated against in any way for exercising these rights, contact your union representative and they will assist you in working through the problem. And if necessary, we will get in touch with the regulators and have a complaint filed. So briefly, when you encounter a health and safety concern that perhaps doesn't warrant a work refusal, there are some basic steps that I can give you to take to help get them addressed. Again, this is very basic, but the first thing you need to do is report your concern to a manager. If your manager doesn't solve the problem to your satisfaction, go to your local union representative and get some assistance. Those local representatives will help you report the issues to the Health and Safety Committee, and if the issues are not solved to your satisfaction, help you report to the regulator your concerns so that we can get them addressed. The regulator's contact information is here for you. There's Labor Canada for federally regulated employees, and there's WCB for provincially regulated employees. I wouldn't worry about trying to determine who to call. If you're not sure, just call one of them and they'll help you. If you have called the wrong people, then they will direct you to the right individuals. Again, these regulators won't get involved unless you can show that you've already dealt with your supervisor, that you've already worked with the Health and Safety Committee, and the issue still isn't solved to your satisfaction, or you're not in agreement with how it was solved. So it's important in the context of COVID-19 that we talk about our concerns with some of the racism that is attached to it. Members of Asian communities, for the bulk of this year in Canada and around the world, have been facing racism and discrimination because of misinformation and stereotypes about the communities that are perceived to be associated with the outbreak. Fear and confusion about this virus should not lead to stereotypes or negative comments or actions towards people because of their race, ethnicity, or place of origin. Biases, racism, and xenophobia actually slow down the response to outbreaks and pandemics, and they contradict the PSAC's principles and the labor movement's principles as well. Here's the contact information for the PSAC Vancouver Regional Office. We'll be sending this presentation out to you, so you don't need to scribble this down, but I want to encourage you to get in touch with us. If there's any confusion, if you can't connect with your local representative, please feel free to call one of our offices and we'll do our best to assist. I also want to encourage you to get involved in the PSAC BC Regional Health and Safety Committee. This is a network of activists across the province. We meet 4 times a year by teleconference and share important information, participate in health and safety events. If you're interested in getting involved in that committee, get in touch with me and I'll be happy to sign you up. Our next meeting is June 3rd at 5:30 p.m. By teleconference. So the third and final poll today, I want to know what webinar topic you would like to see next. We can do the right to refuse in more depth. We can talk about COVID-19 and how it applies to workers' compensation, potential injuries and illnesses that arise, and potential exposures and how to address those with WCB. We could do a webinar on mental health in relation to COVID-19. Or if you have any other ideas, please enter your suggestions into the questions box or get in touch, because we want to know what you're interested in. So feel free to choose some of those topics. And we'll certainly be doing this again. And we're looking forward to getting your feedback as well. So we can tailor these presentations to meet your needs.
Sharon, I just wanted to mention that for the questions and answers section, folks, if you have other questions as things pop up, feel free to enter them into the questions box. I will be giving some of those questions to Sharon to answer, and anything that we don't get to, we will follow up after the webinar. So go ahead, Sharon.
Thanks, Deanna. Oh, I gotta pull my poll up, just a moment. So we got about half the individuals interested in the right to refuse. Good portion of you interested in the WCB piece, and whopping 63% interested in a webinar on mental health and COVID. So that certainly will be taken into account as we roll out the next presentation. And I'm looking forward to seeing some of your suggestions for the individuals who selected something else. So with that said, I think we are ready to move into some questions and answers.
Perfect. Perfect. Okay. So we have a number of great questions. I'm going to start with one. What question from one of the members is, what will be our health and safety related strategy with an increasingly remote workforce? What are the work safe rules and regulations for members working from home?
Great question. Thank you. So the health and safety strategy is your health and safety committee. The rules that apply are the very same rules that apply to you in the workplace. When you are working from home, your home becomes the workplace and your employer is responsible for your health and safety there. Issues should be addressed through the health and safety committee. This working from home situation was very hastily arranged for most of us. We went to work on a Friday. We were told to gather our work tools and start working from home on Monday morning. So certainly we have not enjoyed, and the employer has not enjoyed, a great deal of time to address issues, do risk assessments, and look at specific concerns of individuals. But they are responsible to do that. Any health and safety concerns that you have should be brought directly to your supervisor, and you should be getting a response. I know that in our workplace, they're starting, so the PSAC workplace, we're starting to have some ergonomic assessments and ergonomic trainings, and I would expect that you are receiving that as well. But the basic answer is the same strategy and the same regulations and rules apply to you at home as apply in the workplace. And if you have concerns, bring them to your supervisor and ask to have them addressed at your health and safety committee. Thanks for the question.
Okay, awesome. So we have another question, just kind of a reminder question. So who actually needs to contact Labor Canada if something's happening? Is it the employee, the health and safety committee, or management?
So what I would say is I would expect the employer to do it. I would expect the Health and Safety Committee to support that and to recommend it, because we know that if your supervisor doesn't solve a problem and the committee doesn't solve a problem, that's when the regulator gets contacted. I would, though, certainly take that on myself. I would make sure that the committee or the employer has contacted them, and if not, pick up the phone and give them a call.
Okay, so we have another question. The Occupational Health and Safety Committee where I work has a PIPS rep, but the workplace also has PSAC members in the building. Should our committee also have a PSAC member on it?
So I would have a look at the terms of reference for that committee and see the structure. Certainly, this is something to raise with your local and your component, and get that addressed as soon as you can. Each health and safety committee will have a terms of reference who outlines the participants on the committee. It's definitely something that I think you need to get addressed, and it's something that I would personally recommend that each union have representatives on the committee.
Okay, thank you. Not sure. This is a really kind of a site-specific one, but it was talking about for folks who work on vessels and operate vessels to get from place to place for their work, for example, on a boat or a truck, or they use the boat as just a truck on the water, but they're not actually stationed on the boat for extended periods of time. Are there any special rules that you know of in those types of situations for people who operate different vessels to move about for their work with respect to health and safety and what's happening?
I think that there's the recommendations for social distancing, et cetera, that might be difficult in smaller quarters. There would be prevention plans and health and safety programs specific to your workplace that would address the safety of operating the vessels. Without more information, I couldn't get more specific, but I certainly would welcome this person to contact the office, and we'll try to sort through the specific concerns that they have. Absolutely.
There seems to be, sometimes there's some challenges in different work areas. And so there was one question here, was talking about a supervisor who has taken it upon themselves to do telework. And this specific person had voiced an opinion, and their job can be done at home, but they're expected to actually attend work. Is there any way to navigate that type of situation?
So, I mean, it would depend on the players, right? Who's there and their reasonableness, the relationship between the employer and the union and things. But absolutely, I would be contacting the local union representatives, the component union representatives, and if they need assistance, then they will get in touch with the PSAC for advice and guidance.
I guess also there was another question. I'll take a couple more questions about in different work sites. An example was working in an institution. Does the employer have to provide us with personal protective equipment?
Yes, the employer does have to provide the personal protective equipment required to keep you safe. What's required is, often the question, and those questions are answered at the workplace by the Health and Safety Committee or the Policy Committee. Workplaces, federally regulated workplaces with more than 300 employees have policy committees. So what PPE is required is determined at the workplace by the Health and Safety Committees. And once it's determined what's required, the employer must provide it.
Okay, thank you, Sharon. I guess there was another question around who is the qualified person and who sets out those qualifications.
Yeah, I see that question, and that's a really good one. And if you're looking back at the sort of the definition that I gave of qualified person, it's because of the nature of their training, their knowledge and experience that they're licensed or otherwise qualified to do this job. So there's no, I mean, it depends on, what the individual is being required to do, as to identify what kind of training they need, and what kind of experience and knowledge they need to make these decisions. What I can say is if there is a dispute on whether someone's a qualified person, that's a valid health and safety concern, and pursue it. Raise it to your supervisor, raise it to the health and safety committee, raise it to, after those issues, to the regulator, and find out. There is an answer to that question if you're not convinced that your manager who watched the 6 o'clock news has the training and experience necessary to provide you with advice on what PPE you need.
Okay, and one more question. Do you have a phone number or contact information for employees that are struggling with mental health during these times, and coping with balancing kids' schoolwork and helping their kids and family members, doing deliveries, wearing all these different hats? Do you have any suggestions for that?
So definitely reach out. Your employer has an employee assistance program. Because I don't know where this individual works, I can't provide them with the phone number for EAP. But if they want to contact their local representative, their manager, or just get in touch with our office, and we will find out who your employee assistance program is, and provide you with that contact information. So that's one resource. And we do have additional resources on the PSAC website that can assist you through the tough times.
Okay, thank you, Sharon. Of course, yeah, there's lots of resources on the PSAC website. I just wanted to thank everyone. Sharon, I don't know if you have any other additional comments for folks?
No, I just want to thank everyone myself for joining us, and I'm looking forward to hearing their feedback, and hopefully we'll be able to respond to the rest of the questions we didn't get to in the next day or two.
Yes, there is definitely going to be some communication sent out in the next couple of days. Again, I mentioned that this webinar was being recorded, so the recording will be posted, and Sharon's presentation will be posted as well on the PSAC BC website and the PSAC national website. There is a lot of information, really useful information, also on your component websites as well. There's information for those of you who are part of a component. I also wanted to mention as well and give a plug for the Still Here for Canada campaign that was launched last week. This is an important opportunity for our members to share their stories and experiences and what's happening out there on the ground and the work that everybody is doing. And so I want to definitely reiterate Jamie and Sharon's and all of our thanks for all of the work that you do every day to keep us all safe and secure, and the appreciation goes beyond anything that we could express with words. So I want you all to be safe, and take care of yourself and your families, and ask us any questions that you might have. All of our contact information will be sent out with the presentation. Okay, take care, be safe.
Thank you, everyone.
Thank you.